good to see you here, and thank you for being here. My name is Sandie Ha. I'm an assistant professor in public health here at UC Merced, and I'll be moderating this section today. We have 4 very exciting talks from very accomplished researchers, and I'll be introducing them before they speak. But before we get started, I have a few kind of housekeeping notes. Each presenter will have about 10 minutes to speak. I'll be keeping track of time, so I'll probably poke my head in and say you have 2 minutes left. And we'll leave all questions towards the end of the section. And so as the speakers are speaking, if you have any questions, feel free to put them into the Q&A box. And please try to include the presenter's name who you want to ask. And the panelists, you should be able to share your screen when it is your time. So the first speaker is going to be Dr. Stella Beckman. Dr. Beckman is currently a researcher at the UC Davis Western Center for Agricultural Health and Safety, where one of the many awesome things she does is coordinating a pilot survey of cannabis worker occupation health and safety. Her talk today is titled Allergic and Respiratory Symptoms in California Cannabis Cultivation Workers. So without further ado, Dr. Beckman, welcome.
All right, take myself off mute too. Yeah, so thank you very much, Sandie. I'm going to be talking about a pilot study we did of California cannabis cultivation workers. And why is my slide not advancing?
You may, Dr. Beckham, you may need to click on the lower left-hand corner and click next. It has like an arrow button.
Okay.
That'll, yep.
Okay, I think I got it. There we go. Sorry about that. I have not done this before. So I'm going to start with an introduction to the cannabis industry because it's not a very familiar agricultural product for everyone. Cannabis is the largest cash crop in California, and when you include both the legal and the legacy, which is the unregulated gray and black market, the production is 15 to 16 million pounds a year and $10 billion about in revenues. Employment in the industry is huge. There's nearly 90,000 full-time equivalent workers in California in the licensed industry alone. Cannabis is still illegal at the federal level, and employment statistics aren't collected by any agency. So these estimates that I presented are based on econometric data, and given that 90% about of cannabis is sold outside of California or on the legacy market, this is clearly a huge undercount of total employment in the cannabis industry. So jobs in the cannabis industry range from things like cultivation, manufacturing, all the way down to security guards and delivery drivers, but we are focused on the cultivation workers and trimmers. Cultivators grow the plants, they care for them and tend to them, and trimmers use hand tools to trim the cannabis flowers to prepare them for sale. So most cannabis cultivation in California occurs outdoors on farms like the one you see on the left with a hoop house. And there's a smaller amount that's grown indoors in completely light and temperature controlled grow rooms like the one you can see on the right. This shows a typical trimming setup. We see workers at a folding table. They're using those small handheld scissor tools to trim stems and leaves away from the cannabis flowers to separate them. This is work that's typically paid by the pound, and these workers can work very long shifts doing work that's very detailed, but also very tedious. There is a real lack of research on cannabis worker health. There have been a couple of NIOSH health hazard evaluations and a handful of other studies. These assessments have identified numerous potential hazards in the industry, including things like ergonomic issues and physical hazards and workplace violence. But what we've been focusing on in our work is the effects of respiratory and dermal exposures. There are quite a few of these exposures, but some highlights are things like exposure to the cannabis plant itself, which is known to be an allergen in the clinical setting. We also have microbial contamination, endotoxin, mold, and then exposure to organic dust. So there have been some health effects identified in the limited literature and concerns that we've heard about while talking to cannabis workers and worker advocates. There are mild symptoms like sneezing and coughing. There's also the potential for more severe health problems like asthma, hypersensitivity, pneumonitis, and organic dust toxic syndrome. In terms of dermal exposures, there's complaints of things like skin and eye irritation, hives, and itching. We developed a pilot study at the Western Center for Agricultural Safety and Health with Mark Schenker as the PI. We had a convenient sample of 29 workers from 2 grow sites in the Davis, Sacramento area. These are businesses that we had previous relationships with, and the United Food and Commercial Workers Union helped connect us with a unionized grow, one of them. We gave the workers a self-administered survey that had questions about personal and job characteristics, and then we focused in on respiratory, eye, and dermal symptoms. We had 100% participation for the workers who were available to take the survey, and we compensated them with a $30 gift card just to acknowledge their time and effort. So who were our participants? We knew ahead of time from experience in the business and speaking to the managers that all of the workers were English speaking. And we know that workers at licensed cannabis businesses must be at least 21 years of age. We ended up only having 1 woman participant. And one thing we anticipated was that cannabis consumption would be common among workers. And what we found was that 28 out of 29 of the participants were current cannabis users, and the other person was a former cannabis user. And these workers reported daily or more than daily consumption by smoking or dabbing, which is vaporizing cannabis concentrates to inhale. They were also young, a median of 26 years old. To highlight some of the unique demographic characteristics of these workers, almost half of our workers reported their race as non-Hispanic white. And in terms of education, all of our participants had completed high school, and more than half of them had some college or a college degree, in comparison to other field agricultural workers who are predominantly Latino and often have less than a high school education. These differences from other agricultural workers are consistent with our experience in the field, and particularly among cultivation workers like the ones who participated in our study who have full-time, stable, long-term jobs at licensed grows. This may not be what we would see in other areas of the industry. For job characteristics, we found a median employment total in the cannabis industry was a little over 2 years, with a job duration on the current job of a little less than a year. And for personal protective equipment use, we saw that all of the workers wore gloves for at least some of their tasks, some percent of the day, and use of disposable respirators or face masks was also very common. 90% of the participants wore a mask for at least some part of the day. And the participants who reported using a cartridge respirator, there were fewer, but they wore those for specific tasks like applying pesticides or other chemicals. So for our findings for work-related symptoms, we used a set of questions from the European Community Respiratory Health Survey that we also borrowed from a different study of the cannabis industry in Washington state. And we identified respiratory, nasal, dermal, and eye symptoms, and also whether those symptoms improved when the participant was away from work or worsened while they were at work. Our key findings were that while 17% of participants had physician-diagnosed asthma, nearly 40% reported symptoms that could potentially indicate asthma. These are things like shortness of breath or reporting having asthma attacks. And then for symptoms that could be work-related, we found that 38% of participants reported any work-related symptom, and the most common was nasal irritation, although we did also see quite a bit of eye and respiratory symptoms as well. Our overall findings from the pilot were that the survey format was feasible. Participants were able to complete the written survey in about 20 minutes. We found the unique demographics that we were kind of expecting to see, but it was interesting to see, how much these workers differ from other field agricultural workers. We found that a lot of our participants did report having work-related respiratory, nasal, and dermatologic symptoms. And we also found that a lot of our participants reported asthma symptoms, even though they didn't have physician-diagnosed asthma. And this suggests that cannabis could be an occupational asthmagen, maybe something along the line of Baker's asthma. A limitation that occurs in occupational health research of cannabis workers is that most or all of them are cannabis users. And it's hard to get that contrast between what health effects are due to their exposures at work versus what could be due to their exposures from using cannabis. And of course, this is a little pilot study, but we did get some new and important information about these workers. And I said before, this is a very understudied group. We really just don't know a lot about the health hazards in this industry. And this is an opportunity to kind of get in almost on the ground floor to prevent injury and illness in these workers. And the cannabis business is just exploding in size. So it's really important to get in there early. Where are we going from here? Right now, Dr. Schenker, who is the PI of the pilot, has a study launching in collaboration with the Health Initiative of the Americas at UC Berkeley to study—
1 minute.
How many minutes?
1 minute, sorry.
Oh, I'm almost done, great. So to study worker perceptions and knowledge of health and safety hazards, and that's focusing on the more marginalized seasonal and immigrant workers. We're also developing proposals to study sensitization to cannabis and identify the responsible plant materials using immune assays. And we're thinking about how to gather data to create that contrast group to try to tease out occupational exposures from use-related exposures. Thank you very much. I know Dr. Schenker and or myself would love to hear any questions or comments you have following this panel.
Awesome. Thank you, Dr. Beckman.
Thank you.
Yeah, so so again, if you have any question for any of our panelists, please put them into the Q&A box and we'll try to answer them at the end. So moving right along, we have the next speaker is Miss Leslie Olivares. Excuse me if I pronounce any of your names incorrectly. Ms. Olivares is currently an education and outreach specialist at the UC Davis Western Center for Agricultural Health and Safety, where she's responsible for developing health and safety training materials for farm workers. She is also a project coordinator on a large study that evaluates food security and nutritional status among agricultural workers in California. Her talk today will be about the relationship between anemia and weight status among farm workers in California. Welcome, Ms. Olivares. The stage is yours.
Thank you so much for that introduction. I'm just going to go ahead and share my screen. Okay, and just one tiny correction. So the project that I'm a coordinator for is a smaller pilot study. The one that I'm going to be presenting on today is the much larger study. So good afternoon, everyone. As Sandy said, my name is Leslie. I'm happy to be presenting on behalf of my co-authors, a study on the relationship between anemia and weight status among farm workers in California. I also want to thank and acknowledge all who were involved in making this study possible. So the research team that worked on the study, as well as the farm workers who took the time to participate and the employers who allowed us to collect data at their workplace. And so, as I'm sure we're all aware, farm workers face many challenges that put them at increased risk for developing negative health outcomes. And here are some of the stats from the National Agricultural Workers Survey and the California Institute for Rural Studies, showing the high prevalence of poverty and food insecurity in this population, as well as some of the challenges that they may face in accessing healthcare. I won't go through all of this in detail, but I know that the recording will be available if you want to look at it later. But the point here is to highlight some of the issues that farm worker communities are facing that can impact their nutritional status. And so there's quite a bit of work that has been done looking at overweight and obesity among farm workers. And it's clear that issues of weight and related to chronic illnesses such as diabetes are prevalent in this population. However, not as much is known about micronutrient deficiencies and anemia, which can occur under the context of either undernutrition or overweight and obesity. For anemia in particular, the California Agricultural Workers Health Survey remains the most comprehensive source of information on anemia prevalence among farm workers in California, but we don't know how much this has changed over the past 20 years. So assessing anemia prevalence can be important in this population, not only because of the health consequences of anemia, but because anemia may have economic consequences for these individuals whose jobs rely on their physical work capacity. And so why are we interested in looking at obesity and anemia together, and how are they related? So in the interest of time, I'm not going to go into too much detail with the biological pathway, but I'm happy to answer questions later if anyone's interested. In general, the idea is that when a person is carrying a lot of extra weight, this can cause subclinical inflammation. In response, the body sequesters iron and reduces iron absorption, which over time can lead to a secondary iron deficiency and to anemia. One thing that I want to point out is that anemia and iron deficiency are not synonymous, so one can exist without the other. Severe iron deficiency is just one of the things. Sandie, did you have something? Yeah.
Leslie, do you mind if I interrupt you for a second?
Yeah,
the interpreter asked if you can slow down a little tiny bit so she can catch up. Thank you.
Okay, I'm so sorry. I'm a fast talker. Okay, so as I was saying, severe iron deficiency is just one of the many things that can cause someone to develop anemia. So recent studies have looked at this in other populations, and some have found associations between obesity and either iron deficiency or anemia, but it hasn't been looked at in farm workers, despite this being a population where overweight and obesity are prevalent. Okay, so here's what we wanted to learn more about in this sample of adult farm workers living in California. The primary objectives of this study were to determine the prevalence of anemia and overweight and obesity, assess the relationship between hematocrit and BMI, identify factors that may be associated with hematocrit concentration and anemia, and lastly, identify factors that may be associated with BMI and obesity. So this was actually a secondary analysis of data from the California Heat Illness Prevention Study, which you already heard about in a previous session. But here are some of the data collection methods that were relevant to what we were looking at here. So it was a convenience sample of 587 farm workers that were recruited from 30 farms throughout California in 2014 and in 2015. And this was done through farms and farm labor contractors. Questionnaires were administered by bilingual interviewers to collect basic demographic information like age, gender, income, education, etc. And weight and height were measured. So workers were weighed without shoes, wearing only a base layer of clothing. So just making sure that they removed any sweaters, extra shirts, hats, anything that they may have in their pockets, things like that. For the analysis, we used the numbers that were collected in the morning before their work shift. And so hematocrit was measured in capillary blood samples. Again, we used results from the morning. And anemia was defined as a hematocrit less than 36% for women and less than 39% for men. We applied linear or logistic regression for continuous and dichotomous outcomes respectively. And this was done to examine the association between hematocrit and BMI, and also to identify factors that may be associated with anemia and obesity. And so on average, our male participants had a hematocrit of 46%, and on average, our female participants had a hematocrit of 40.5%. Overall, about 3% of participants had anemia. Among men, only 1.6% of them had anemia, and among women, only 6.2% of them had anemia. So we observed low anemia prevalence in the sample regardless of gender. And so here we have the results for BMI and weight status. As you can see, on average, our participants had a BMI of about 29, which would fall into the overweight category. And on average, women tended to have a higher BMI. Similar to what has been reported in previous work, we saw high prevalence of overweight and obesity, with about 43% of participants in the overweight category and about 38% of participants in the obese category. And so when examining the relationship between hematocrit and BMI, we did not observe a significant association. However, we did observe that hematocrit was greater among younger adults, men, those who primarily spoke English and had a higher serum osmolality, which we used as an indicator for being less hydrated. And people were less likely to be anemic if they were younger, male, and had had a higher serum osmolality. And so for BMI, we observed that it was higher for men who were non-smokers, did not primarily speak a language that was categorized as other or indigenous in comparison to Spanish speakers, and had worked in agriculture for more years. Among women, BMI was higher if they primarily spoke English in comparison to Spanish speakers. And lastly, obesity was less likely among those who spoke a language categorized as other or indigenous in comparison to Spanish speakers. And so in this sample of farm workers, overweight and obesity were prevalent, with about 81% of all participants being either overweight or obese. But anemia prevalence was low at about 3%, with women being more likely to have a lower hematocrit and a higher BMI. In thinking about what could explain our findings, at least in part, one thing to consider is the healthy worker effect. So this is where the prevalence of negative health outcomes can be masked when looking at only a actively working population in comparison to the population as a whole. And it's also important to note that this study required permission from their employer. So working conditions that can promote an unhealthy circumstances in other parts of their lives could be less, it would be less likely for them to feel comfortable letting a research team come in and ask their workers questions about their job.
You have 2 minutes.
Okay, I'm almost done. So another thing to consider are the potential factors that we couldn't look into simply because we didn't have the data. So although the original study gave us quite a bit of data to work with, ultimately it wasn't designed with these questions in mind. So for instance, biomarker data to look at specifically the role of inflammation and iron deficiency in anemia were not available in this population. So this is more of an initial characterization of the burden of anemia among farm workers in California and the factors that can be associated with anemia in this population, which can be examined more closely in further research, for instance, targeting more vulnerable groups within the farm worker community. And so lastly, I just want to thank the Western Center for Agricultural Health and Safety and the National Institute for Occupational Safety and Health for supporting the study, as well as the farm workers who took the time to participate and were willing to provide so much information for us to work with, and their employers who allowed us to collect data at their site, and the study team that made this project possible. Thank you.
Thank you so much, Leslie. That was really interesting. And again, we're going to hold the questions until the end. Our next speaker is going to be Dr. Paul Mills. Dr. Mills is currently a professor at UCSF Fresno. His research interest centers around understanding determinants of cancer, especially those that are hormone mediated. His talk today will be about gene-environment interactions in cancer risk among California Hispanic farm workers. Dr. Mills, the virtual stage is yours. Is Dr. Mill here? See if he's, can one of the technicians check to see if Dr. Mill was accidentally in the attendee?
Dr. Ha, I don't see him in here. I don't see him in the attendees as well. So
okay.
We can maybe come back. Maybe he's having issues logging in.
Maybe, yeah.
I will email him, and we can go on to the next presentation for the moment being.
Okay, that sounds great. Let me see if our next speaker is here. So our next speaker is Dr. Brenda Eskenazi. Let me see if she's here. Dr. Eskenazi, are you here?
I'm here.
Yes, awesome. Okay, so let me introduce you first. So Dr. Brenda Eskenazi is currently a professor at UC Berkeley. She also wears many other hats too, one of which is being the director of the Center for Environmental Research and Children's Health. She works locally and globally on the effect of environmental exposures on the health of children. In addition, she is also leading several important research projects to evaluate the effect of COVID-19 on farm workers, which is, I think, what she's going to be talking about today. Her talk is going to be about the COVID-19 and its impact on the health of Californian farm workers and their families, the tale of two cities. Dr. Eskenazi, welcome.
Thank you, and it's been a pleasure to hear everybody's talk, so I'll take it from there. I'm going to be talking about two different studies, the tale of two farm worker family studies. I'd like to acknowledge my co-principal investigators, Julie Deardorff, Anna Maria Mora, who you've heard this morning, and Joe Leonard at UC Berkeley, and Dr. Max Cuevas at Clínica de Salud de Valle de Salinas. So our studies take place in Monterey County. It's called the Salad Bowl of the Nation. We have been working with Clínica de Salud de Valle de Salinas for about almost 25 years. It's a federally qualified health center. It was founded in 1980 to serve agricultural community families. It's comprised of 12 clinics throughout Monterey County. And we began SARS-CoV-2 testing there on June 15th and supported by HRSA grants. We have been working with Clínica de Salud to do these two studies that I'm going to be talking about. The Chamaco study, which stands for the Center for the Health Assessment of Mothers and Children of Salinas. We started in 1998 with funding from NIEHS, National Institute of Environmental Health Sciences, and EPA. And we are continuing to study these families. We enrolled about 600 pregnant women in 1999 to 2000 in a birth cohort study. The mothers had to be less than 20 weeks gestation, spoke Spanish or English, delivering at Natividad Hospital, which is the county hospital, and receiving prenatal care at Clínica de Salud or at Natividad. In 2009, we enrolled 305 more dyads. We are a community university partnership. We have followed these mothers and children now for more than 18 years. Following these families, the mothers and their children, about every year to 2 years. And up until COVID, we have been following the children doing an 18-year assessment, but then COVID hit and we were restricted from actually examining the families because of concern. But by that point, we had interviewed about 479 mothers and their youth. We re-interviewed them by Zoom on May 13th to August 12th. And I'm going to present some of those data. In addition, by Zoom, we also conducted 3 virtual focus groups with some of the participants. I'm going to be talking about only one of the focus groups that was conducted with the Chamacos mothers. We used qualitative methods to analyze those data. Just to give you an idea of what the Chamacos families look like, 92% spoke Spanish, 85% were born in Mexico. Most at the time of their pregnancy have been in the United States for less than 5 years, economically impoverished, had low education level. About half of the Chamacos mothers were working in agriculture during their pregnancies, but even if they themselves had not worked in agriculture, they lived in agricultural families. In July 16th, we started a SARS-CoV-2 infection study in Monterey County that Dr. Mora presented in the first session, in which we enrolled over 1,000 farm workers. These were the criteria for being in the study, and this was the procedure, including a very detailed questionnaire that was conducted by phone and also measuring height and weight, for which they received a $50 gift certificate in addition to the collection of biosamples. So if you look at the characteristics of the farm worker study, Dr. Mora presented this earlier, they look very much like the Chamacos cohort in that they were mostly Latino, born in Mexico, but with a high risk of obesity, hypertension, and diabetes. Because we only interviewed in English and in Spanish, we probably underestimated the number of indigenous population in the community. So we asked the question, what has been the impact of COVID-19 on these farm workers and their families? We were concerned about their concern of COVID-19 effects, their perceived impact on their lives, the mental health impact, and food security. So I will be giving a bunch of slides showing first on the left-hand side, the Chamacos cohort, and then on the right-hand side, the farm worker cohort. So the first question is, are you concerned about COVID-19? And as you can see, most of the Chamacos mothers, 72%, were either moderately concerned or very concerned. If you look at the farm worker cohort, it was a little bit higher, 85% were either very concerned or moderately concerned. We also asked about how has COVID-19 impacted their lives? And this was a broad question. By the way, these questions were similar to questions that NIH had used in other studies. In the Chamacos cohort, they said that extremely negative, 14%, moderately negative, 38%. In the farm worker study, a bit higher in terms of extremely negative, 24%, and moderately negative, 34%. I will say that the Chamacos cohort was interviewed in a slightly earlier time period, although they overlapped in the interview time, as you can see at the bottom. We asked about anxiety and depression using standardized scales, again, scales that have been well utilized through NIH grants. And you can see that in the Chamacos mothers and in their youth, we see fairly high levels of anxiety and depression. In the youth, over 40% reported anxiety. In the mothers, close to 40%. Around depression, we see about 25% for youth, and for mothers, we see over 30%. In the farm worker cohort, we use a slightly different scale because of the time frame that we had to interview. And so we can't directly compare the percentages between Chamacos and the farm worker study. So we see about 15% in anxiety and close to 20% in depression. We also use the USDA scale for looking at food security. And in the Chamacos cohort, and we see that about 30% were very low food security or low food security. So 30% of insecure. If you look at the farm worker study, we're seeing a little bit higher percent, about 36% are food insecure. Now, what we could do in the Chamacos study is, since we had interviewed the mothers right before COVID began, we had a basis of comparison, which is very unusual, to be able to look at a before and after. Many of them have been interviewed just a few months before the pandemic began. So we could see, for example, how their levels of depression changed from before to during the pandemic. And you can see that before it was hovering around 29%, and during it was 34%, and there was a statistical significant increase in depression.
2 minutes.
Okay. For anxiety, we see something similar, about a 25% before and over 35% after. And again, we see a statistically significant increase. Similarly, for food insecurity, before it was close to 28%, and during it was closer to 40%. Again, we see an increase during the pandemic. So we have a direct comparison from before and during the pandemic. We also looked at the mental health impacts through the focus groups, and these were the different themes: fear of infecting family members, stress from work changes, worry about children's schooling, particularly from the mothers, compounding financial, health, and immigration stressors, worried about taking care of their dependents, especially when they had to work, and of course, the stress compounded by immigration politics. Here are some of the quotes that the mothers gave in the focus groups. I can't sleep for the same reason that, oh my God, if I were to get infected with COVID-19, what's going to happen to my little kids and my elderly mom? Another quote about work uncertainty. So yeah, just nothing from anxiety, from not knowing what's going to happen and about how we will meet our needs and cover our expenses. Another one on burdens on undocumented families. The families that are mixed status like ours have been economically affected because instead of receiving $1,200 and $500 for each child, we get only $500 for the person who is undocumented. The policy feels racist, unjust, and we need to fight these causes. They were compounded by immigration policies, husbands being separated from wives, children being separated from families because of public charge. So in summary, the farm worker communities in Monterey County, California, we found 31 to 40% very concerned about COVID-19, 14 to 24% saying the pandemic had extremely negative effect on their lives. About a third of the families are food insecure, and these negative effects have included an increase in a before-after comparison in depression, anxiety, and food insecurity, compounding stress from economic uncertainty and health and immigration concerns. I'd like to thank my collaborators and our staff and our funders, and of course, the farm workers. Thank you.
Thank you, Dr. Eskenazi. And I last heard that Dr. Mills is trying to connect. Oh, and I just heard that he cannot connect for some reason, maybe a technical difficulty. But we're waiting to see what happens. We can go ahead and, well, first of all, thank you to all the panelists for your very interesting presentation and for the important work that you're doing for our farm workers community. So then I'm going to go ahead and I guess read some of the questions that I received from our audience. So the first one is for Leslie. The question is whether BMI has any limitation for estimating obesity among populations who do physical labor.
Yeah, so the limitations of BMI are pretty well known in that they don't take muscle mass into account. They don't take bone density into account. There's just a lot of things that limits it as an indicator for adiposity. So that's one of the limitations of this project. When I was doing my literature review, I did see other studies, not looking at farm workers, but that looked at more like the types of obesity. So android obesity, how fat was distributed. So yeah, I definitely think there are limitations to BMI. But this, like I said, this is an initial characterization, and definitely if more work was done in this type of a study, I would definitely want more details on that. But especially it doesn't consider body type. So I know with like when I studied abroad in Oaxaca, we got to talk about how, you know, there were women, indigenous women, who were being categorized as overweight, but they looked completely normal. And it's just that their body was just shaped a little bit differently. So yeah, I definitely agree that there are limitations to BMI here.
Great, thank you. I also have not really follow up, but I also have a question. So I think in the presentation, you mentioned about the rates of anemia in the population. I think it was like no, I can't remember the number, but like 2% or something like that, right? How is that compared to the rate of anemia in the general population? I think you mentioned low, right? But was how different is that? Just curious.
So I don't remember the numbers off the top of my head, but I have them written down. I can look them up right now. So I have the data from the NHANES study, so the national average. So I'll look that up real quick. Maybe you can ask another question.
Sandy, I just wanted to point out that Dr. Mills is on now.
Oh, okay. Awesome. Dr. Mill is on. Awesome. Thank you, Brenda. So let me introduce Dr. Mills real quick, and I'm sorry for, I think he was experiencing some technical difficulty. And so Dr. Mill is a professor at UCSF Fresno, and I think I kind of introduced him a little earlier, but found out that he's not here, but I'm going to do it again. His research centers around understanding determinants of cancer, specifically the cancers that are more hormonal dependent. His talk is going to be about the gene and environment interactions in cancer risk among California Hispanic farm workers. So Dr. Mill, the virtual stage is yours, and I'm sorry for the technical difficulty.
Thank you, Dr. Ha. Good afternoon, everyone. I'm not sure if the technical difficulties were at your end or at my end, but what I will do is I'll try to truncate my comments a little bit this afternoon. I do want to talk a little bit about a long-term study that we have had ongoing in the United Farm Workers cohort, which we established 25 years ago. And in this instance, we're going to be talking about what we call gene and environment interactions in cancer risk among the California Hispanic farm worker population. Even though we've already heard a lot about farm workers today, I think it's always helpful to take a step back and ask, who are farm workers here in California? And the American Community Survey from the census data, of course, gives us some good information, predominantly men, predominantly in their working ages, predominantly Hispanic, mostly not citizens of the United States, very low educational attainment and live in poverty and are lacking adequate access to health insurance and health care. If we ask again, and we have data from the American Community Service, where do farm workers, where are they located here in California? Well, as you can see from this map, predominantly here in the Central Valley, down in Imperial County, a little bit up in the northern Central Valley counties of the state. This is where the predominant farm worker populations are working in the fields, in which I'll be discussing some of the exposures that they might have in that workplace environment. Previous studies of farmers have yielded very interesting results in terms of what occupational hazards they experience. It's interesting to note that overall farmers experienced lower overall mortality than the general population. If you think about comparing farm workers to firefighters, to police officers, to members of the active military, you might understand that difference. It also might be explained by what's called the Hispanic paradox. However, over the years, we've noticed that cancer of the liver, lung, stomach, prostate, as well as leukemia and lymphoma is more commonly found in farm workers than in the general population. Some previous work that we've done here in the Central Valley with my colleagues at Keck School of Medicine at USC, we've done questionnaire type studies where we've obtained crop and job specific histories from farm workers, and we've linked these job and crop specific histories to the California Department of Pesticide Regulation, pesticide use reports. As you can see here, for one fumigant, methyl bromide, we've seen for prostate cancer elevated risks in our farm worker population. And this is work that we did in Kern County, Tulare County, and Kings County a number of years ago. What we're currently talking about is looking within, and this was in the general population, and what we're currently talking about is doing studies of cancer in the farm worker population who were members at one time or another of the United Farm Workers of America, the union founded by Dolores Huerta and Cesar Chavez back in the 1970s. So in this study, we had a couple of questions to answer. Primarily, we know that many pesticidal chemicals have been associated with increased prostate cancer risk from, again, the literature and our own work. And we're in this kind of environment, we're asking, in addition to the pesticidal chemicals, are there certain gene by environmental interactions? That is there some genetic proclivities or mutations that may increase risk above and beyond risk associated with the pesticide exposure itself? So we're asking in this study, are there gene by environmental interactions for prostate cancer in the Hispanic farm working population in California? We'll be looking at a couple of classes of pesticides and a couple of classes of genes. But we might ask, why study genes to begin with? And what do we mean by gene-environment interactions? What is a single nucleotide polymorphism? And why is it relevant to cancer induction? Well, again, just by way of review, a lot of us know what the structure of DNA looks like. We have the, nucleotide sequence within a given strand of DNA. And when we say we're looking at SNPs or mutations, single nucleotide polymorphisms, we're saying that a normal wild type nucleotide is replaced by a mutation. In this case, the cytosine is being replaced by adenine nucleotide. Well, what does that mean? It means that, if we have a wild type gene and we have the ability to elaborate the enzyme that gene codes for, well, then that carcinogen is, you might say, gobbled up. I make an analogy to lactose intolerance. If you lack the enzyme to digest lactose and you drink milk or other dairy products, you will get sick. What we're saying here is that if you have a SNP, if you have a single nucleotide polymorphism that results in the incomplete expression of enzymes, well, the carcinogen is not fully metabolized. And if you have that's usually what we call the heterozygous. If we have the homozygous mutant, we have even a poorer ability to actually metabolize the carcinogens. So what we did in this study is a record linkage between the United Farmworkers of America and the California Cancer Registry to identify prostate cancer cases. We interviewed both prostate men, like men with prostate cancer, and controls, healthy controls, to obtain comprehensive lifestyle characteristics as well as occupational, residential location histories. We also obtained saliva samples so that we could extract DNA and use PCR to do the analysis of the SNPs and create pesticide profiles using an innovative mechanism developed by my colleagues down at Keck at USC. Again, what we're doing here is a record linkage between the database of the United Farmworkers of America, some 140,000 workers, and the much larger database of the California Cancer Registry in an effort to identify prostate cancer cases in the farm worker population. What we found is interesting. This is just looking at the genotyping results for one gene, the cytochrome P450 gene, where we're looking at the blue is the homogeneous wild type, which means it's the type of the gene that can fully elaborate an enzyme that will metabolize the carcinogen. But we see here in the red and the green, those proportions that show the heterozygous or homozygous mutant forms, which do not elaborate the enzyme. So when we looked at, for example, this cytochrome P450 isoleucine to valine transition, going from those that had the wild type form of the gene to those that had some form of the mutation, we saw an increase, about a doubling in the risk of prostate cancer in those men. And that's kind of a novel finding that we're currently writing up. And then when we looked at one particular chemical that we had investigated previously, methyl bromide, we saw somewhat of an elevation in prostate cancer risk, an odds ratio of about 1.35, but it wasn't statistically significant. The question that we posed in this study and that we tried to answer is that if we combine exposure to methyl bromide with the inability to metabolize the pesticide, what is the risk for cancer? And what we see in this table, of course, is 4 categories, going from the reference category of being not exposed and having the wild type gene that protects us against cancer, all the way to the highest quartile where we see exposure being associated, combined with having the mutated form of the gene. We see a 3.5-fold elevation in prostate cancer risk in this farm worker population. And again, the very small trend value here indicates that this is not a chance finding. So I know we're running out of time, but graphically, if we wanted to illustrate the combined interactive relationship between polymorphisms in some genes and exposure to some of these chemicals, we see a pretty, I think, convincing dose response relationship showing increased risk of prostate cancer in this environment. So in this prostate cancer case control study, we were able to look at 11 different SNPs targeting 5 metabolizing genes. We looked at 3 classes of agricultural chemicals. I'm only talking about fumigants this afternoon, but we did note significant interactions for prostate cancer risk in this farm worker population, especially between the phase 1 metabolizing gene CYP1A1 and not only methyl bromide, but organochlorine and organophosphate exposures in the work site. I'm finishing up my time. I see, Sandy, that my time is almost up. Before I conclude, I'd like to say we appreciate all the work that the farm workers that continue to do in the fields, and we appreciate those that participated in our study, as well as to the leadership and staff at the Unit Farm Worker Headquarters in Keene, California, including Tanis Ibarra, Doug Blaylock, and Patrick Pine. I'd also like to thank faculty, friends, students at Fresno State, at the UCSF Fresno program, and the UCSF IRB for continuing oversight of this important research. And of course, thank you to the very generous funding from the NIH and the American Cancer Society. And that concludes my remarks. I'll turn the stage back over to Sandy.
Well, thank you. Thank you, Dr. Mills, for that very interesting work. So I think we're all on time. Great. I have one question for you, Dr. Mill, from, and the question, and I'm gonna pretty much quote the question because I don't have the knowledge in this field to paraphrase. So the question is, have you considered the PON genes given their direct involvement with OPs? I guess.
The short answer is no, but the peroxidase gene that you're referring to is of very high interest to us. In, of course, any funding application, we had to limit the number of genes that we were going to target. In this particular one, we looked at the cytochrome P450 genes and the glutathione S transferase genes. But in future applications, we very much would like to look at the PON because of their relationship, as suggested in the question, with the ability to metabolize the organophosphates, which of course have taken over really from the organochlorines, certainly as used as insecticides. Thank you.
Awesome. I think those are all the questions I received from the Q&A box as well as the chat box, but I do want to give Leslie the opportunity to, I think she was in the middle of answering her question when you joined, Dr. Mills. I wanted to give her the opportunity to follow up on that if she found the answer. Leslie, did you have any follow-up?
Yeah, so I wanted to give the exact number. I didn't want to just estimate, but the national numbers for anemia were 5.6% in the last INHANE. So that's in total. For women, it was 7.6, and for men, it was 3.5%. So the overall prevalence of anemia nationally was higher than what our study found. But there's a lot to take into consideration there, especially considering that our population was an actively working population. So everyone who was there didn't have an illness severe enough to keep them from working. It didn't take into account people who might have been injured and weren't working in that moment. And another thing to point out is that even the national data, the NHANES data, it's over almost around a 10-year period. So in general, what they found were that the prevalence of anemia among Hispanics was generally higher throughout that whole 10-year period. And actually the highest increase of anemia prevalence was for Hispanic men. So their rates increased the most as they collected more data throughout the year. So that's just something to keep in mind, that there's still a lot of things that need to be considered before we get to, all the data needs to be taken with a grain of salt. And one other thing I wanted to point out is that even in the NHANES data, they mentioned that specifically Mexican American women, they were more than two times likely to develop anemia in comparison to white women. So there's just so many little things to consider. So I just wanted to add those few points.
Awesome.
May I ask a question, Sandy, or state something?
Of course, go ahead, Brenda.
So Leslie, you talked about obesity and maybe we're not measuring properly because of bone density and things like that. I just want to point out that there is a growing body of evidence that is showing that obesity is of course related to severity of COVID, but it's also now seemed to be related to the incidence of COVID, so that people that are obese are more likely to get infected. So I just want to put that out there, and we're seeing that in our farm worker prop study. We saw that in our farm worker study. So even if it's not correctly measured, we should be using maybe impedance or some other measure. It's showing us something that we need to be considering.
Absolutely.
Yeah, it's very concerning, all the things that obesity puts you at risk in. And even with our study, we didn't see anything with anemia and hematocrit specifically, but you know, just because someone doesn't have anemia doesn't mean that they might not have iron deficiency. So there are the more subtle changes that we just weren't able to detect because our original study just wasn't designed to answer these specific questions. But yes, thank you, Dr. Brenda, for chiming in.
And you didn't measure ferritin, right? You measured hematocrit only. Okay.
No, but we do have a pilot study that we started after where we're looking at ferritin, STFR, iron in general, and AGP, CRP, things like that, because we want to answer those questions a little more.
Can I make another comment at this time for Stella? And that is that we are seeing that a number of people are considering of converting their vegetable farms to cannabis right now, because it's so much more productive in terms of so much more revenues coming in that way. So the findings that you're showing, Stella, are really important because we're going to see more workers that are going to be affected.
Yeah.
All right. Yeah. Awesome.
And they're working indoors, at least in Monterey County, they have to work in hoop tents.
Yeah.
All right. Okay, thank you. I know we're right on time, so I want to kind of, again, thank you everybody, all the panelists and the audience for a very engaging session. And so I'm going to leave the floor to the next moderator, Ron.
Yeah, thank